It's 5:30. I'm getting ready to go into work. Doug's making tacos, and I feel this weird mix of like anxiety and being okay. So I don't know how the night's gonna go, but I'm gonna take some vitamins, eat some food, finish putting on my scrubs, and then get ready to go. I'm in my car, and I'm about to do my daily wipe down. So I thought I'd talk about a few things. I'm not going to talk really about the majority of my shift because that's not anything to... My hands are clean, by the way. That's not anything to write home about. God, what the fuck was I going to say? By the way, it's like 8:30 in the morning. I just got off work. I got this lick of hair here. So the face shield that I have to wear so it doesn't fall off your head, you have to have this dial. So you have to like crank it in to like tighten it to your head. And then I was also wearing a surgical mask. So I had that kind of up and over my ears. So it feels like I have giant open sores on my ears now after one shift. Oh, and then the other thing was they were doing, so because I'm about to go through critical care training, like intensive care unit training, one of the things that they're doing is they're doing all these little demonstrations in the ICU, however much time we got before this shit hits us really hard. I got to go watch a demonstration, participate in a demonstration of how to prone a patient. Prone means face down. When people are really, really sick and they're having like really bad respiratory failure, you can inflate the lungs better if they're not laying on their back. So what they'll do is there's a special way that I learned last night. They will take a person that is intubated, they will flip them upside down so they're laying on their belly in bed. They're sedated, they're paralyzed, intubated, probably have God knows what else, IVs, chest tubes, flexi, Foley, whatever. So there's a special way, and I'm not going to get into it because I'm tired and I won't explain it well. But we learned how to do that, and then we flip a mannequin back over to their back. That was interesting to see. That does not mean that I'm not scared and that I'm not anxious and that I still would rather not have to do this, but everybody has to do this. We're all playing our part. But what the charge nurse did tell me, which makes me feel a little better, is that unless the shit hits the fan in a way that's worse than we're even expecting now, the plan is that all of those of us that are like intermediate and like med-surg nurses that are being trained in ICU, we're being trained so that we could ideally, if we have a bunch of COVID patients come in, we can surge or deploy to ICU, and then we can take kind of their low acuity tier of patients, which even with low acuity, you still have vents and vasopressors and like all sorts of other shit that I don't usually deal with. So that if we take those lower acuity patients, then those ICU nurses and ECMO nurses can take those higher acuity COVID patients. Because my understanding is that like COVID patients go, oh, I'm sick, intubated, prone, like very quickly for those that like are, you know, critical. It made me feel a little bit better to know that they're not going to be like, welcome to the ICU, here is your first proned, vented patient with a ventric, they're bucking the vent, have a good shift. Like, that's not what's going to happen. I knew that, but it's just really nice to hear that the plan is that we are not going to suddenly become like the first line COVID responders with a week of ICU training. However, caveat in nursing is that shit can change at any second, especially with this current pandemic. 2 weeks ago, I didn't think we'd be here like this. So I have no idea what it's going to look like 2 weeks from now or a month from now. You will hear about it if I end up doing any more ICU shit because the anxiety is kicking. All right, I want to go to bed. I don't have to go back tonight. We're going to call it here. Happy nursing. Oh my God, you guys, I'm still self-isolating. It's still COVID time, unfortunately, but it's a gorgeous day and I am running some no contact errands, and I have a little Mac here with me. Say hi, Mac. Lovely. I have the windows down. It's like maybe in the 60s, maybe pushing 70s, but I'm taking a rake to Brad because he needs to like fix some holes that his dog made in the yard and he wanted my rake. So I'm taking him a rake, and then I'm gonna drop off and leave on my mom's doorknob a couple of cloth face masks that were made by a coworker's sister-in-law. And then, last but not least, I'm going to throw some recycling in a gigantic recycling bin 6 feet away from any other humans. I'm not touching anything. I have my hand sanitizer. I got my Lysol. Got a coffee. All right, well, that last clip ended with me being followed by a cop for about 4 or 5 blocks, so I decided not to film in the car anymore. But there were a lot of people out and about. They all seemed to be social distancing appropriately. Lots of dog walkers, lots of joggers, lots of rollerbladers, Well, rollerblading must be the new thing. I wish I hadn't sold my rollerblade. But I got all my errands run, dropped off a couple of face masks for my family, just left them hanging on the doorknob. My mom was like, "You're so sneaky. I didn't even hear you." And I was like, "I'm a night shift nurse. I am especially sneaky."
You ain't special!
Well, Doug has made a vlog cameo now. Scared the shit out of me. I have been more productive today, even though I'm having wicked cramps and a backache. But I got that stuff done. I have to put the sheets back on the bed because I wanted to clean and sanitize everything. So I'm going to actually put my blankets in the dryer with some essential oils on the dryer balls. That makes everything smell really nice. I'm going to do that, finish up some other stuff, and then Doug and I are going to watch some TV when he's done with his class. I don't know why I'm in such a good mood. I think it was that huge coffee that I drank. It's April 3rd. Today was a rough day for me. That's why I have red lipstick on, because I needed to do something. I don't even know what. It was a rough day. I haven't been sleeping well. I've been having weird dreams, nightmares, not like monster nightmares, but like being trapped at work nightmares, like touching my face at work nightmares, those kind. I mean, I'm laughing because it's absurd, but it's really not. I want to talk to you about how it's okay to have a rough day. This shit sucks. Like, you don't have to be productive every day. I've been saying for like 4 days that I'm gonna do these online training modules, and I haven't gone back to them. Tonight, I'm going to do them. In the next few hours, I'm going to just get it finished because I have my first ICU shift tomorrow. Let me back up for a second. I woke up this morning, I was tired, feeling weird, and I was having cramps. Like, I was having straight up, felt like my uterus was trying to rocket out of my body. Backache, hips were hurting, like it was just, I was like, oh God, COVID plus this. So I basically went to bed with the heating pad, thinking I was just gonna like watch some Will and Grace in bed, maybe nap a little bit. And then I woke up and it was like 8 p.m. So I hung out with Doug for a little while. We watched our nightly episode of Twin Peaks. We're like halfway through season 2, and man, is that shit weird. I've never seen it before, but I'm addicted. I slept for most of the day, but also I've been emotional and tearful. Doug and I have had some good talks that have made me feel better. You know, we've kind of got a plan for what our plans for the coming weeks are. It's just, it's like surreal. What am I even talking about? I've restarted this video like 3 times. I don't even know what I'm here to talk to you about. I just wanted to check in because it makes me feel a little better, and a couple people have sent me messages that said they like hearing from me. I don't know. I'm gonna keep doing it till I get enough insulting comments that I don't want to do it anymore. Today was a really unproductive, emotional, negative, pessimistic day for me. It was the first real big one that I've had. I've been stressed, I've been tense, and feeling a little guilty about it because I haven't been working that much, and there are lots of nurses that are working a lot and in shitty conditions, and so I feel guilty even saying that I'm struggling, but I am struggling. My mom has messaged me begging me to be careful, asking me if it's okay for me to be going to my job. Kind of heartbreaking. Doug and I have, had many discussions throughout this, and we're a team, and I'm grateful to have. I think we have a relatively good plan for keeping ourselves safe. I told him that I just needed a day to just take up space, and that's exactly what I did. I need to drink some water, eat some nutritious food, do some yoga, move my body, and not feel like I need to be productive. The one thing that I do need to do is I need to watch these fucking ICU training videos. Go sit at my computer, and I'm gonna learn how to be an ICU nurse on the fly. The point I'm trying to drive home is that I'm checking in with myself, making sure I'm treating myself well, and that I'm not just allowing myself to succumb to boredom, worry, depression, isolation, whatever it is. I encourage you to do the same. I work the night of the 4th, and I'll be heading into the medical ICU to train. I'm gonna quit talking. I'm gonna have some water. I'm debating. I made some coffee. Should I be cranking coffee into my body right now? The correct answer is probably no, but am I gonna drink it? Yes. I'll talk to you later. Stay safe, guys. Happy. It's my MICU training day. So, I took my temperature. I'm 36.7 Celsius, so I do not have a fever. Took all my vitamins. I feel anxious a little bit, but not like I thought I was going to. I'm pretty sure that the emotional roller coaster I've been on the last several days probably burned out all of my emotion. I'm just kind of feeling a little numb. careful, of course. I'm a burnt candle. I don't really have any emotions right now. I just feel kind of, I'm gonna go to work and see how this goes. I took the ibuprofen because I'm gonna have a fucking plastic face shield / helmet screwed into my head all night. Ooh, it's warm out. The weather is definitely changing. It was a beautiful day. I slept with the windows open. I think my hospital is doing a good job. I know I'm gonna get my temperature checked on the way in, screened for cough and other symptoms. They did a thermal scanner, they asked me some screening questions, and I'm in. I'm going to my unit to get my report sheet, my blank report sheets, the MICU skills checklist that I need to have my preceptor sign. But I think I'm gonna take all my shit with me so I don't have to come back up here at all. Just want to stay in one place. I'm supposed to show you my helmet or anything, but I'm walking down 2 floors to MICU. It looks like I have bolts fucking screwed into my head, and that's what it feels like. I kind of fucking love that they have a pop machine in their break room. Okay, it's about 2 a.m. Nothing scary so far. I'm actually going down to the cardiovascular ICU for some skills training. I'm trying to eat a kind bar while I do it. So far, I've zeroed an arterial line, given some meds. Can't focus. I'm trying to walk down the stairs without falling. It's been okay. They've been nice. It's been quite the eye-opening experience. I just went to a training. We talked about pressors, another review of art lines. They let me leave a little bit early because they're going over vent stuff, and I already know vent stuff, so I'm gonna go see if I can eat some lunch. All right, well, I'm taking a 4 a.m. lab run. I'm taking some blood to the blood bank. I'm in a part of the hospital I don't usually come to. It's very quiet. But let's talk a little bit about what I've done so far. So I kind of already told you I drew blood off an art line, zeroed an art line, flushed an art line. I've hung propofol, done some ET tube suctioning, did some assessments, including neuro exams on patients that are sedated. Just kind of learning, listening to them talk about their COVIDs, what they do with their COVID positive patients. They actually have to get the swabs from someone. They don't just have swabs laying around. And then I'm not sure how fast the testing is, but I think that they've been testing. Turnaround is actually pretty quick compared to what it has been. So the fear that I had surrounding going to MICU is still there because I'm not yet working on my own, and I've only been there for 1 shift. But it has greatly alleviated my nervousness just because they're so helpful. They're so willing to explain things. It's been a positive experience. I just spit on myself. This is why they have us wearing shields. It hasn't been so bad. I feel a lot better about it. I will still, I'm sure, have anxiety if I have to actually put my money where my mouth is and actually work in ICU. But I don't know. So far, I know this, but my anxiety is always worse than the actual situation warrants. I'll say it, not as bad as I thought, and I'm really glad to. Well, I made it down 7 floors, across 2 pavilions, across the skywalk, down 2 levels, and then I had the thought, do I have my car keys? Fortunately, I did. I'm going home. Well, this was an unforeseen turn of events. It is Monday, April 6th. I worked in MICU night before last, and I woke up this evening with some postnasal drip and a dry cough and no fever. Because I have a new cough, I had to alert my employee health clinic, and now in 30 minutes I will be tested for COVID. Even though I don't think this is it, I'm still freaked out. I'm gonna put my mask back on. All right, well, I'm at the family medicine clinic. They have a special entrance set up for people that are being tested for COVID, so I'm gonna head in there. I don't think I'm gonna be able to take any footage, so I'll just let you know how it goes in a minute. All right, so I pulled into the parking ramp, walked across the little driveway from the ramp to the building. Walked in, everybody was in PPE. They had me sanitize my hands. I already had a mask on. all of their employees were in gowns, gloves, and masks and face shields. They gave me a little barcode sticker, and I put my little barcode on my shirt, and here it still is. They printed out the lab label, swabbed me, but they swabbed the back of my throat, but then they said, okay, now a bigger and I went, oh, and they like went down my throat. It wasn't pleasant, but like I had strep testing so frequently as a child that I'm like, whatever, you stick your arm down there, it's fine. But then the test like kind of irritated me even more, so now I feel all like phlegmy and sore, because she was like, thank God it wasn't the nasal one where they like bury the fucking swab all the way into your sinuses. I don't feel short of breath. I'm not having any respiratory issues. It's just this cough and the sniffles, and I sneezed like 3 times before I left the house. I asked if I would have results tonight, and they said it just depends on lab availability and what they got going on, so I don't know how they run it, but they basically said like go home and stay home and isolate till you have results. Which really blows, because I'd like to sit in the living room and watch TV with Doug, but I don't want Doug to get sick. I'm basically in my office / second bedroom till I get these fucking results. I'm gonna eat some food and grab some tea, and I'm just gonna go hide. This blows because now not only am I on quarantine and like stay at home order, but now I can't be near Doug. Keep my mask on, excellent hand hygiene, keep my distance. Let's hope it's fucking nothing. Okay, well, I'm home, so now it's time for the ritual cleaning of all the knobs and shit that I touched. So, steering wheel, volume controls, heat, or I should say AC. I had the AC on because I'm fucking that hot. Car buttons, door handle, interior door handle, exterior door handle, gear shifter. Alright, I think I've wiped everything down. Alright, so let's wrap this up. I waited approximately 17 hours for results. I basically just came home and went to bed and slept in really, really late, and I woke up to the phone ringing, and they asked me to identify myself, and I did. Well, they identified themselves. They asked me to identify myself, and I said, is it okay if I give you some test results? And I said, yes, please. Told me I was negative. I suspected that was it. I still have a sore throat and a little bit of congestion, so I probably just have the regular coronavirus. So I'm okay. I'm all right. This isn't the end of the world. Good. When I go back to work, if I still have these symptoms, obviously I'll wear a mask, but I now have not this headband, but the headband I wear to work. I have buttons on either side now so that I can just hook my surgical mask to the buttons and save my ears from getting sore. The employee health clinic offered to follow up with me in like 3 days, just like a telehealth appointment, and I'm gonna take them up on that just to make sure I'm better, and if not, to do something about it. So I guess that's all there is to it. So I'm gonna try to finish editing this vlog for you tonight and see, or rather morning, it's almost 5, and then I think I'm gonna do what I've been doing, and that is on the warm mornings, I go for a walk as soon as the sun is up. There aren't as many, so I don't have to worry as much about social distancing or a whole bunch of droplets in the air.